and I come from DRC. I'm so happy to be with you in this session. So I'm going to invite my colleague Angela to talk to us about the best practices that we need to use in order to follow this meeting well. I would like to tell you that those of you that speak English, down there's a globe on which you can click
vous permettre de suivre en anglais.
Choice. Is a globe on at the bottom of your screen. So there won't be any barrier for us to exchange because we have interpretation that will allow us to follow in our languages. Angela, I'll give you the floor to give us the slides about the housekeeping aspects.
Hello, can you hear me?
Yes, Angela, I can hear you clearly.
Yes, good afternoon, ladies and gentlemen. Thank you so much for joining the second session of our eco series that will be happening. My name is Angela. I don't know if they can see me. Yes, my background is not so clear. My name is Angela Musewa. I'm based at the Uganda country office. I'll be taking you through the housekeeping rules for today's session. Allow me to share my screen with you. Mark, kindly help me project on your end. I don't know what's happening. I can't share my screen on this side. I can go through them as you share. Kindly help me project them, the housekeeping rules.
Ok, donne-moi juste une minute, je vais partager.
Give me just a minute, I'll be sharing. Give me just 1 minute and I share the screen. Do you see my screen?
Yes, we can. Okay, kindly put it in presentation mode. Okay. So colleagues, we are having a session on the emerging and re-emerging infectious diseases on the African continent, a case of rabies in DRC, the eco session 2. Next slide. These are the housekeeping rules that we are going to follow today. Next slide, please. We encourage you to rename yourselves with your proper name and the organization. However, if the bandwidth allows, please keep your videos on. Keep mics mute at all times, unless if you're speaking or if you're called to speak to us. Next slide. We have interpretations in French and English. Try to click on the interpretation button just below here. You'll be able to access the services that you need. Click on interpretation and choose the language that you'd like to hear the interpreted language only, and click mute original audio. Next slide. For live transcription, click on live transcription and choose show subtitle, and caption would appear on the screen. To close the caption, click hide subtitle. Next slide. We encourage you for any questions. You can use two options, a Q&A and the chat, but we really encourage you to use the Q&A icon. To use the Q&A feature for questions regarding the topic and the presentation, you go click on it, type the question, and you get prompt response. Alternatively, you can also use the chat. Use chat feature for questions regarding IT logistics or the certificate of attendance. Chat echo IT to troubleshoot any Zoom problems so that you're able to enjoy the sessions. Next chat, next slide. It's important to note that the session is being recorded and your attendance is consent to be recorded. Recordings as well as the presentation slides will be shared by email after the session. Regarding the session feedback, to obtain a certificate of attendance, you'll be asked to complete a short 2 to 3 minute survey. The link to the survey will be provided in the Zoom chat near the end of the session. Colleagues, we encourage you to mute yourselves, mute your mics unless you've been called to speak. Next slide, please. Next slide. Data usage. Afrohun will collect registration, participation, questions and answers, chat, comments, and poll responses. Your individual data will be kept confidential. This data will be used for reports, maps, communication, surveys, quality assurance, evaluation, or research, and to inform any new initiatives that we will undertake. And next slide, kindly. Yes, this is the brief agenda. I've taken you through the housekeeping items. The case presentation is going to be made by Dr. Range. The direct presentation will be made by Dr. Mungogo. The discussion will be led by myself and Christine Muhomuza. The Q&A session will be led by Mr. Samuel Wanjohi from Kenya, and he will also wrap up and make any further announcements. Thank you so much for listening. Over to you, Chair.
Merci beaucoup, Angela, pour cette introduction. Merci à tous ceux qui...
Thank you for that introduction. Thank you all for listening. I hope once again you are welcome. We are very happy to have you here. And allow me to take 1 minute to give the floor to Christine in case she has anything to tell us before we start the session. Christine, yeah, we are ready to start. I just wanted to know if you have any information or anything else that, an opening word that you would like to give us before we start the session.
Thank you, Mark. You are all welcome. I think I do not have anything specific to pass on now, but just to welcome everyone to this session. And over to you, Mark. Okay.
Merci. Donc, sans plus tarder.
Thank you. Without wasting time, we are going to give the floor to Dr. Serge. He's going to give us the case study, which we are going to discuss today. He has 15 minutes to present it. And during the presentation, there will be questions. Remember to write. If you have suggestions, you can write the answers in the chat. And you can also use that time for question and answer to ask the questions that you may have. But I would also like to reiterate that interpretation is available. So there's a globe below your screen on which you can click to follow us directly, whether in English or in French. Once again, thank you very much. I'm going to share the presentation of Dr. Serge, and I'll give him the floor to present the case study which we are going to talk about today.
Docteur Serge, je pense que vous pouvez voir mon écran et vous avez 15 minutes pour
I
nous.
hope you can see my screen, so you have 15 minutes to present to us the case study. And we are asking those that have just joined to rename themselves. Please put your name and your organization. You can tell us which university you come from so that we get to know you. You also have, if the means allow, you can open your camera so that we see you. I hope Dr. Sage is listening, so he has the floor to go on with his presentation. We are going to present our case study, which is entitled
Alors, nous allons parler des maladies
we are going
infectieuses.
to talk about emerging and re-emerging infectious diseases, a case of rabies in Democratic Republic of Congo. Dr. Rango Mofolo Serge is the one presenting. So we are going to have an introduction. We have the case, rabies, and then after that we shall have the questions.
Oui. Ici, nous représentons
And here we have a map, an administrative map to show you the commune of Mongafula, in the city of Kinshasa. Mongafula shares boundaries with the Central Congo, where we have a forest, where some wild animals live. So there are dogs and other animals. Rabies is a well-known deadly emergency infectious disease. So domestic dogs are involved in more than 90% human cases. However, wild animals are reservoirs of the disease. So they get in touch. How? Because during what happens, it is because of the bitings or the saliva that they may leave on the body. So it is one of the priority zoonotic diseases in the Democratic Republic of Congo. It is endemic in our country. Now, we as a veterinary service, we are involved in the prevention, surveillance, and response to animal diseases, including rabies. Here, we are going to talk about a case study. There's a gentleman who was visited by a dog at his place at 4 a.m. in the morning. So he heard noise in his surroundings. When he got out, he was ferociously attacked by the dog, and he was bitten on the arm. So when the wife heard the noise, she also came out to see what had happened. And from there, when she got out of the house, she too was attacked by the dog, the same dog. And like, there are people that got out of the high area, out of the houses, they came out. They beat up the dog. But there is a question that we are asking at this level. We have the people. First of all, the couple that was attacked by the dog, then we have the dog, then we have the community, the people in that village that came out to beat the dog. So what are we supposed to do in terms of One Health? What can be done? Because the man that was bitten by the dog had a wound that was bleeding and he needed to be treated. And in the framework of One Health, what can be done finally? We are waiting for your answers in the chat. At that time, the veterinary department was informed by the community, and then they too were supposed to inform the human health so that they can come together to do some inquiries. Then the human health window took care of the victims. And when it comes to the veterinary side, there was a joint investigation to find out more about the life of the dog or the origin of the dog. So that's investigations were done to find out the origin of that dog. At least sample collections for lab analysis were collected, sent to the lab to find out what had happened. It was in the laboratory of the Biomedical Research Institute. After the rapid testing, the sample was positive to rabies. After getting the response about the investigations on the dog, it was identified that it was a stray dog coming from the neighboring village of Congo Central, where there was an ongoing rabies outbreak. Now, the two people were treated. First of all, their wounds were cleaned, and then post-exposure prophylaxis against rabies was done on them. Then, after being treated with the support of students from One Health Club, a rabies sensitization was conducted, and then vaccination campaigns were done to vaccinate the dogs in the region. So in this picture, we have Dr. Saj, the inspector of Mongafula commune, together with the One Health Club students. They organized vaccination in that commune just to fight against rabies. So beside me, there is a finalist who comes from the Faculty of Veterinary Medicine, University of Kinshasa. Then behind me, there is another student. We received support from those students in order to organize that operation. These are the last minutes where we were concluding the vaccination exercise. Still within our commune, these are the students of veterinary medicine and environment. Now, we have challenges to avert. For example, some of the dog owners were not willing to vaccinate their dogs because of cultural beliefs. For example, some of them eat the dogs and they are afraid to have their dogs vaccinated because according to them, it will be very toxic to their health. We also have another problem where stray dogs are still a challenge for rabies control in our context, more especially rabies. Now, we have questions that we asked ourselves. How can we effectively control stray dogs? The second question, which approach can be used to convince all dog owners to have their dogs vaccinated? That is the end. Thank you very much.
Merci beaucoup, Dr. Serge, pour cette très belle présentation.
Thank you very much, Dr. Serge, for that very good presentation. I hope everyone has managed to follow religiously. It's not clear. We can't hear him. It's not heard. Mark is not heard. I think he has a problem of connection. Thank you, Dr. Serge, for that very good presentation. We are very happy to have followed you. Thank you for sharing with us that case study, which we really appreciate. I have noted that during the presentation, you asked some questions which I am putting on the screen to allow everyone that is online to read them and give us some answers. So the questions are there. There are two. The first one is how we can effectively control stray dogs. And the second one, which approach can be used to convince all dog owners to have their dogs vaccinated without any problem. You have the questions. You can write your answers in the chat. We shall read them and then react. What can you put in the chat, for example, to answer those questions? But in the meantime, quickly, we need to remind you that interpretation is available. We have interpretation. So if you're an English speaker, you can click on the globe below your screen and choose a language of your choice, whether it is English or French, so that you can ably follow the presentations. So we are waiting for your comments or answers to the questions that were asked. So you can share your experience with us in the chat on how we can effectively control the stray dogs and which approach can be used to convince all dog owners to have their dogs vaccinated. Thank you very much. We are waiting for your answers in the chat, but quickly, I would like to give the floor to Dr. Konyamongo, who is the second person that is going to talk to us about rabies. However, please don't forget to write your answers on how we can effectively control stray dogs and which approach can be used to convince all dog owners to have their dogs vaccinated. Thank you. Thank you. Thank you very much, Dr. Mark, for the floor. I think you can hear me very well. Hello. Hello.
Vous m'entendez? Ok, merci beaucoup.
Thank you very much. I am going to give some answers on how we can effectively control the stray dogs. It depends on the country. First of all, the most effective measures we can think of organize centers where we can get all the stray dogs and put them at the center and have them rehabilitated, and then ensure that there are people to treat them. And then also vaccinate them using the necessary means. They can all be captured and vaccinated, but also they can be castrated. They can be sterilized, they can be castrated, and this will help fight rabies. Obviously, we talk about the well-being of animals, but given that they are stray dogs, which pose a challenge, a problem, personally, I find that the welfare of those animals needs to be taken care of. We should not kill them, but we can put them at a center, confine them at a center where they can be rehabilitated and vaccinated. Thank you very much.
D'accepter, cela dépend. Nous avons un problème culturel. Nous avons
concerning owners, we have cultural problems. Some people won't really allow us to vaccinate their dogs. So we need to be accompanied with the anthropologists who are going to explain to them the benefits of vaccination. And this one will help them to understand how important it is to vaccinate their dogs. And they should also know the risks that they are living with if they don't vaccinate their dogs against rabies. Thank you very much. Thank you, Dr. Paulin, for those answers to our questions. And we still have some more minutes to see if we still have some comments we could share concerning a control of these stray dogs. I've seen the chat. There are some answers that I'm going to read some. So that before we give the floor to Pauline to continue the pedagogical part of it. So someone is saying that the best way is to be in position to control these dogs. through their owners, we need to reinforce the law so that everybody is, so we need to protect our people using all the possible means. This is what Hussein wrote in the chat. Juvenal Kagarama also says that the control to put in place is to put in place how to control these stray dogs, because this is the responsibility of human resource, animal resources ministry. So we also need to put in place laws obliging owners to vaccinate their animals. So these are some of the comments that I have managed, the answers I've managed to read. You can go through them to be in position to clarify them and know more about this topic. So without wasting time, we are going to give the floor to Dr. Paulin Mobongo, who is going to give us the presentation on the RDC rabies situation. Otherwise, you can continue writing in the chats if you have questions in Q&A and even in the chat in general. So we are going to continue moving together with you to help you to be together as people participating to this ongoing meeting. So without wasting time, let me or allow me to share Dr. Paulin's presentations concerning the rabies situation in DRC. We are going to give him the floor so that he can give us his comment, and at the end, we are going to follow together. If you have questions, please interact using chat. I hope you can see the screen that I've shared. Can you let me know if you can see the screen, please? Thank you. So the floor is to Dr. Pauline Mbongo. He's a veterinary doctor by training, specializing in veterinary medicine of wild animals. Worked on bonobos especially, and is the head of department of the University of Kinshasa. Is going to talk about us about the rabies situation in DRC. So you can ask questions, you can make comments, and you can also share with us your experience in your countries, respective countries. So Dr. Pauline, you have the floor. Thank you, Mark, for your presentation. You have said everything. So I'm also an old boy of one healthy a club in DRC. An old boy of that club. So the situation, the rabies situation in DRC, this is our small presentation plan. We're going to go through together. We're going to talk about the introduction. We are going to talk about rabies in DRC, and then the control strategies, the national program, rabies control program at the national level, as well as talk about challenges for rabies control in DRC. So rabies, as my colleague has talked about, this is a virus. So it is Lassa virus, and it's a zoonotic disease. DRC is really preoccupied because it's an endemic problem. This is the main disease for the WHO in DRC. So the transmission, dogs play the biggest role in transmission. So this is 99% by dogs. So, and when there are symptoms towards on the human level, the 100% is really fatal if people have got symptoms. So according to the global estimations, we're talking over 60,000 people concerned with the rabies. 95% is in Africa, and then children are concerned, affected up to 50%. So WHO estimates that a yearly cost of $6.6 billion. This is a lot of money invested. This is really very, very expensive. So it's a public health concern. So we can also see on this map the risks, the rabies risk map. And so mainly Asia and Africa are the most really affected. These are the two continents which are really in total red. DRC is not really, is also concerned by this sickness, by this disease. Transmission, we have reservoir in the world, especially the bats, which really, and then we have dogs and some other wild animals, which cause problems to the animals and towards domestic animals and the humans who can get this disease from these various animals. So when we talk about dogs, the rabies spread is when a dog is rabid, there's a change in heavier, too much saliva. When the person who has been, bitten, people might have symptoms or signs of fever, headaches, weaknesses, and sometimes people even think they have malaria. And the symptoms are going to at a later stage, and when it worsens, people can even die. Most people die, in fact, of this disease. The whole country, or all countries where this problem is concerned, these countries are working to eliminate this disease. In DRC, we're doing the same. I want to achieve the global target for rabies elimination by 2030. And DRC, thanks to support from partners, there is a national plan to fight against rabies, and we are working on it to achieve the total elimination by so from 0 stage to stage 5 to be declared. So, but for us, we are still really very low as far as the fight against rabies is concerned. We're still at a very low level. So we can ask ourselves a few questions. What is the situation of rabies in your country, for instance? And have you ever heard or seen or talk about rabies in your community? In your community, we need a reply and we need answers to these two questions, please. What's the situation of rabies in your country? Have you ever seen, heard about rabies and rabies cases in your country? So you can answer through Q&A, answer those two questions. In the DRC, the first case of human rabies was reported in 1923, and at this level, rabies was declared by authorities as zootic in 1950, the first case of human rabies in the capital of Kinshasa was detected in May 2009. And ever since, we have had ever increasing cases of rabies, especially in Congo Central. We have some more figures here from the epidemiological data from 2010 to 2020. As you can see, 2010 to 2020, 10,498 cases. And we're talking about stray dogs at the national level and in the capital. So deaths between 2010 and 2020, 157 cases of death. So this is the total number of people who have lost their life because of rabies. So we do not have these are still estimations. We really don't have the exact figure. It could be worse. So we asked you a few questions. Can you please give us 3 strategies for rabies control in the country? We asked this question with our fellow citizens, Dr. Ranger. If your country, does your country have a rabies control plan? You can tell us. And in this control plan, do we have One Health approaches which are taken into account? So you have the small screen, you just click on the answers you have as per the 3 questions. Is it yes or no? Just click and then send. So you have 2 minutes to do this.
Oui, voilà, donc vous pouvez voir les questions qui s'affichent sur votre écran. Ce sont des questions très importantes qui sont posées.
These are very important questions that have been asked. So we'd like to know whether you have a national plan, and we would also like to know if there's mention of One Health approaches as far as this program is concerned. I'm also going to share with you the reply or the responses to these questions. Okay, there's too much echo from Dr. Mark. I can hardly interpret him.
Pour les gens qui parlent français,
so for those who speak French, can you give us 3 strategies? Your country. The second question is that if your country has a control plan, I mean, does your country have a rabies control plan? Third question, does this plan mention One Health approach? One Health approach or One Health approaches? Thank you for some of you have replied. Can you share with us your answers to these questions, please, if someone has access to this?
Yes,
so we can see 90% yes, no, and 10% That was for the first question. The second question, we have 90% yes and 10% no. And the third question, yes, 71%.
Vous pouvez le constater, la rage est
And realize rabies is considered as a disease which is really neglected, and this is why we have that's why we still have rabies in our country, because most of
problème de santé publique parce que
many,
nous avons
a lot
parlé
of partners do not
des décès.
really
Chaque année, le cas des décès au pays, d'attirer de bailleurs contre ces fléaux.
Together fight against this problem.
Voilà, nous allons continuer avec la présentation. Selon l'approche progressive vers l'élimination de la rage, situation au niveau de la RDC. La RDC
together, according to, so we're going to talk about DRC, stepwise approach. So we have 1.5 score in 2021. We have a national plan that was put in place. That's why we have the score. And CARE score, successfully done, yes. There's a lot of efforts put in place to put in place this national rabies control program. This is the score as the so we have the national plan of DRC of rabies control that was developed in June in 2021.
endémique.
Why? We developed the national plan to eliminate the rabies by 2030. And this will only happen if we work with One Health working group, a task force, which is in place in DRC, and really they have worked with us to put in place this national plan. So let us look at what the content of this control plan. So this plan targets that is ownership of the national plan. So like this plan to be a priority first and foremost toward the politicians and authorities, because without them we can do nothing. And we also need to use collaboration using One Health approach. So to develop capacities of the staff that will be involved in this implementation of the action plan. We also need to involve the local community because the national plan, which does not take into consideration the local community, is really called failure right from the beginning, because there will be no local support.
Je voulais juste m'assurer que la traduction en anglais se passe bien et que vous nous suivez correctement.
I wanted to cross-check if there is interpretation towards English. So I wanted to check if there is interpretation
Message qui est donné au cours de cette présentation. Donc, je voulais juste
to follow as we present. So the English speakers, can you tell us clearly if you are following this presentation?
bien parce que la traduction se passe bien. Merci beaucoup. Donc, je vois des commentaires dans le chat. Je voulais juste me rassurer que cela est pris en compte pour permettre à tout le prochain avancer. Merci. Je voulais juste me rassurer que ça se passe bien pour l'anglais et que la traduction.
I can have it. So I just wanted to cross check whether the interpretation was working.
Si vous pouvez essayer de jeter un coup d'œil pour que ceux qui nous suivent en anglais puissent nous suivre clairement. Alors, Dr. Paulin, vous avez la parole pour continuer. Je m'excuse de vous avoir interrompu.
Dr. Paulin, please continue with your presentation. So this was very important. Dr. Mark, thank you very much. Let's continue now. So I was talking to you about the national action plan against rabies in DRC, and that the public authorities need to really work together to have a final answer. So we have multidisciplinary aspect in order to succeed. We also need to have capacity development for the staff that will be involved. So we talked also of local community involvement, without which the national plan against rabies it's to failure at the beginning. So we also need to have resources, good governance and adequate resource mobilization. We also need to have a bit of an accessibility of human and animal rabies vaccines in order to vaccinate the dogs, but also treatment of people who have been bitten by dogs. We also need a cross-border cooperation. The DRC is surrounded by 9 countries. We can manage our country, but as long as the 9 neighbors are doing nothing, we cannot
sauvages qui quittent les stratégies de mise en œuvre de ces plans nationaux. Je parlais de ça, on vise une collaboration multidisciplinaire et surtout la vaccination de plus de 70% de chiens. Et là, on compte les chiens domestiques, mais aussi le chien errant. Il faut une vaccination, une couverture vaccinale qui peut atteindre 70% pour arriver à contrôler la rage au niveau du pays. Et il faut se battre aussi, contrôler les chiens errants. Nous avons parlé des différentes stratégies.
Docteur Paulin, pardon, une fois de plus de pouvoir vous interrompre. Je voulais juste demander si Sarah pouvait prendre un tout petit peu la traduction en anglaise pour permettre à nos collègues qui nous suivent en anglais de bien suivre la présentation. Sarah, si vous m'écoutez, je proposerais que vous puissiez prendre la traduction pour aider nos collègues qui nous suivent en anglais à suivre la présentation. Merci de me confirmer si cela est fait.
OK.
Je voulais me rassurer si cela reste que c'est fait.
Yes.
Merci beaucoup. Donc, Dr. Paulin peut alors continuer. Parce que j'ai vu dans le chat qu'il y a certains de nos collègues qui ne nous suivent pas bien. Dr. Paulin, tu peux alors continuer. Vous étiez en train de commenter la mise en œuvre du plan de lutte contre la rage de la RDC, donc en tenant compte de la stratégie de mise en œuvre et des résultats attendus. Encore une fois, je m'excuse de vous avoir interrompu.
Voilà. Merci beaucoup, docteur Marc. J'ai présenté les stratégies de mise en œuvre. On vise multidisciplinaire, prenant en compte l'approche la vaccination 70%, plus
We
de
also need to
70%
vaccinate more than 70%
pour nous permettre
of domestic dogs and stray dogs in order to enable us to control effectively rabies.
Il faudrait contrôler le chien errant. Nous avons parlé avec la première présentation de différentes stratégies qui peuvent être utilisées pour contrôler.
Strategies can be used to control the rabies, but there's also another aspect that is very important, that is the sensitization of the partners in the community to help them so that they can implement these national plans. We need support of all those people in order to achieve those objectives. And the results, expected results, we are saying that we need to have a national plan that is functional and which takes into account, it must be functional, functional mechanism. And then at least 70% of the dog population must be vaccinated. And by 2033, the country must be declared free of rabies. And then finally, the status of the OIE, rabies, must be free. It must be obtained, that status. When we come to the strategies at national level, there's the National Office for Vaccination and Control of Rabies, but at that level, the services take into account vaccination of the dogs, of the people that are bitten by the dogs, but also data collection on rabies, sensitization of the people, but also law enforcement. And this is to help put in place a surveillance plan in the entire country. The funds usually come from the government, from the dog owners. We said that dog owners must be responsible. They must take their responsibility. They must play their role by having their dogs vaccinated, but there are also funds that are expected from the private sector. We have an example here, for example, for the dog owners who have the responsibility of having their dogs vaccinated. They have to spend between $5 and $10 every year on the vaccination of their dogs. Then the government must strengthen the rabies surveillance plan and ensure that there is enforcement of the law. For example, where the dog owners must have their dogs vaccination. The private sector and public sector also has a role to play in partnership with the vaccine manufacturers to increase accessibility to vaccinate at a low cost. And then that will help fight rabies in the entire country. Now we have another series of questions. First of all, we have just seen the challenges in controlling rabies. And we have a question: what are the challenges for rabies control in your community? What are the challenges for controlling rabies in your community? And if you can share some of the challenges that you encounter, if you can also give us some strategies for controlling rabies in your community or in your country, It will help us a lot. We are giving you 2 minutes to answer the questions. You can even use the chat to answer the questions. I'll repeat the questions for those that are following in French. We need, for the first question, to find out the challenges for controlling rabies in your community. And the second question, can you share the strategies to overcome the challenges in your community or in your country? Thank you. Do not hesitate to give us your answers. We are waiting for them. You have 2 minutes to answer those 2 questions.
Merci beaucoup, Dr. Paulin. Donc, c'est très, très intéressant. Merci pour
Thank you, Dr. Paulin. It was very interesting. Thank you for those that are sharing. I can see that there are already answers that are posted in the chat. The first challenge, which I can see, is that of the stray dogs in the communities. According to David Mwanguzi, who says that there are so many stray dogs, and if they are there are many, it is difficult to control rabies. For strategies of control, Dr. Berulu is saying that sensitization is very weak in the communities. So the communities must report the cases of rabies to the responsible health officers. Then David Mwanguzi says that there are problems linked to accessibility of the treatment in many countries, and this is a major problem.
Il y a encore des outils au départ. Et Hussein Mohamed, pour lui, il dit qu'il y a encore beaucoup de problèmes liés.
There are many gadgets that are open. There's interference. We cannot follow properly. Mary Grace Akulu says that there's very poor surveillance of rabies. They're saying that sensitization in the community must be done so that the dog owners can have their dogs vaccinated. But the cost of the vaccine is also another challenge. So these are the comments that are in the chat. You can continue with the presentation. Thank you very much. We thank everyone for your answers that you have given us. We have so many challenges, it is true. Like in DRC, we talked about the cost of the vaccine, which is very expensive. You also have the aspect of the culture and norms. There are people who eat dogs and they refuse to have their dogs vaccinated because they think that they will have problems if they eat vaccinated dog meat. They are also, they refuse. Also, the hunters do not want to have their dogs vaccinated because they think they will not be able to hunt. So these are the challenges that stop people from controlling the spread of rabies effectively. As challenges, we have lack of surveillance data, which takes into account the One Health approach. Someone talked about it in the comments. We do not have a system or systems of surveillance that are very efficient in our country. And that means that rabies has remained as an endemic in our country. Then dog vaccination must at least reach a coverage of 70% in order to ensure effective control, but it is still a problem if the stray dogs are still there. So if you have to vaccinate and reach that coverage, when the stray dogs are still there, you cannot make headway. There's also a problem of non-application of the law. The government must ask the people to be responsible and have their dogs vaccinated. If you're a dog owner, you have to make sure that it gets enough necessary treatment. You must feed it well, even give it enough care that it needs. We are also talking about the funds, which are not often mobilized to fight against rabies because it is considered to be a neglected disease. Then there are some countries that have managed to eradicate rabies, but in other countries, it is still a problem. Like in our country, we are still facing problems. We do not even have funders to help us in the programs for fighting rabies. Then there is also poverty. People as poverty, they cannot even afford the cost of vaccinating their dogs. There's also a problem of stray dogs. There's a problem of cultural behavior, but there's also lack of involvement of the local population in some programs. For example, the program of eliminating rabies. So the local population must be involved if you are to achieve those expected results. And here you can see we have the surveillance system of One Wealth in the country. We have a sector of animal health, and also the human health. When it comes to animal health, we talk about the domestic animals, but also wild animals. So this is a system that is not very efficient. Sometimes the notifications are not regular. The system does not function at all. When it comes to the human health, we also have a system that functions well with some programs that are stable, and this helps control a number of diseases. Information starts from the grassroots up to the top, but there's a problem of sharing information between the animal health and the human health sector. So each sector runs its information on its own independently. There's no sharing. So that's why when it comes to dog bites, the information is not shared within the human sector. So that is a challenge. Information must be shared between those two sectors. Thank you very much for your attention. We are at your disposal to answer your questions or to respond to your clarifications. Thank you very much.
Dr. Paulin, pour cette brillante présentation qui est très claire, qui montre un tout petit peu.
Thank you, Dr. Pauline, for that brilliant presentation. Thank you for talking to us about the problems of rabies. Reading the comments in the chat, I discovered that the situation is more or less similar with that of the participants. Like it was said, there's poor surveillance, poor involvement of the community, poverty, and sometimes sensitization. For example, David Mwangozi says that sensitization is one of the most important strategies that can be used to fight rabies. There's also Juvenal from Rwanda who is sharing.
C'est que quand les problèmes de rage arrivent dans la communauté,
is that when rabies come to the community or is spread in the community,
grave que les professionnels de santé animale soient directement impliqués. Je vois grâce qui dit,
animal health, the animal health professionals are supposed to be involved. But there's also another participant who says that community involvement is a problem. So since we still have some minutes, we are going to give you the floor to either tell us the questions that are in the chat or answer directly the questions that were asked. You can share with us your experience. We still have some few minutes. Please rename yourself and tell us what your name is and the country or organization that you come from. But we'd also like to find out who has a question. You can put up your hand to ask your question or make a comment. If you have a comment, any addition on the presentation of Dr. Paulin, you can put up your hand and we give you the floor. Is there anyone that has anything to add on the presentation that was made so that we give you the floor? Yes, Juvenal, you can switch on your mic and ask your question or make your comment.
I noted that, I can't remember who, but in the year 2016 and I think 2020, there was bites and deaths. What happened during those years? I think it was one of the first presentations.
OK, apparemment, nous n'avons pas bien suivi votre question. Est-ce que vous pouvez revenir un peu sur la question pour permettre à l'équipe?
We haven't followed your question very well. Can you please come again? Somewhere you broke. I was saying that in one of your presentations, between 2016 and 2020, there were many dog bites. What happened during those years? Thank you. The question is very clear now, and Dr. Paulin has noted it. Any other question?
And Mark, while I still have the microphone.
Alors que j'ai toujours la parole, j'ai un commentaire que j'ai mis au niveau du chat.
Although rabies is a fatal case, but its spread is not as dramatic as the other zoonotic. And therefore, the focus towards its prevention is not as proportional to the threat that it causes. So this is a challenge. What can be done to rectify this kind of, or in your experience, what would you advise anybody?
Merci beaucoup, ça c'est bien noté. Le fait qu'il y a...
Thank you very much, well noted. Because there's less importance that is accorded to rabies because its transmission is not as bad as that of other diseases. I think there should be sensitization, like there's less sensitization about it, and sometimes that is why it is ignored. Maybe we can share here, but we must make sure that we organize many activities in the communities for sensitization. I can see there are many people that are putting up their hands. Thank you, Mark, for that session. I have the two questions. The first one is that as we see in Europe concerning rabies, the major cause is not domestic animals, but rather wild animals. I would like to find out if there are studies that are conducted on the wild animals. Second question, you are encouraging collaboration between the professional people and in the area of animal health and those of human health. I don't know if you have any plans on zoonotic animals. I don't know if you have strategies to facilitate collaborations between the two sectors. We shall give him time to answer that first round of questions. But if you have any comment, any compliment, you can still put up your hand or write in the chat. But we prefer that you put up your hand. However, we are asking you to switch on your video so that we can see you.
Merci beaucoup, Dr. Marc.
Thank you, Dr. Mark. And we thank the participants who are attaching a lot of importance to the subject. Regarding the first question that was asked by a colleague, wanting to find out why the number of dog bites were too many at a given period of time. What we have noted in our country is that if you have a stray dog, sometimes there are dogs that move in a group. And if there's a stray dog or a dog that has rabies, it is going to propagate this disease to all the other dogs, and they'll also start biting others. So definitely the dog bite cases will increase over a period of time, so over the years, in different years. I think Dr. Serge, who works in the community, has a lot of experience in that. He witnessed increasing dog bites over a period of time, or during 1 year or over the years. So you can link them to the number of dogs that were infected, and then they got in touch with other dogs, thereby increasing the number of dog bites. When it comes to the question on whether some studies have been conducted to find out more about the reservoirs of rabies in Congo, yes, there are studies. For example, in central Congo, where we have Kinshasa, there are cases of rabies that have been confirmed with the jackals. These are interesting studies, and they should continue, and probably we shall find out the other reservoirs that are not yet identified. So studies are conducted, and we have a case of jackal near Kinshasa, where they confirmed rabies from wild animals. Thank you, Dr. Mark.
Merci, Dr. Paulin.
Thank you, Dr. Pauline, for answering those questions.
Alors, j'aimerais voir dans les chats. Docteur Chifedal, est-ce que vous avez un complément par rapport à la réponse que vous avez reçue ou une information à nous ajouter?
Do you have any complement and information that you can share with us? Maybe a compliment.
Maybe during those years, where in the records was due perhaps to a more how shall I put it? More data collection and more data sharing. In addition, of course, to an increase in dog bites. So could we say that that could have been a complement to it as well? Have I made myself clear, Marc?
Oui, docteur Juvenal, nous vous suivons très bien. Merci pour les partages.
Thank you for sharing. It is very interesting. But I've also seen someone sharing in the chat is Yakub from Nigeria. Yakub, can you please switch on your microphone and ask your question?
Thank you very much for giving me the permission to participate in this presentation. My question really was that in a government like ours, Nigeria, the advocacy for rabies is quite low, and which accounts for the reason why rabies vaccine is not very available available for dogs, except for people who have the means to do that. And like most part of West Africa, stray dogs are a problem. And without the government participating and making these vaccines very available, I don't foresee any tangible milestone being achieved in the eradication of rabies by the time of 2033. So my question is, how do we go about trying to advocate for the government to appreciate the scale of the problem so that they can come in and help us achieve this goal of 2033? Yeah, thank you very much.
Thank you very much, Yakub. This is a very interesting question about raising awareness of leaders. On me signale que je dois rentrer en français.
I'm going back to French. Is there someone that has an answer to the question that Yakub has asked? You can even give your opinion in the chat. However, if you can, maybe you can put up your hand and share with us. For example, people from Tanzania, you can share with us your experience. Professor Kileo, are you there? Can you share something with us?
I'm there. What kind of experience do you want us to share?
Yeah, how to deal with stray dogs. I saw that you gave a
sorry,
good comment.
I cannot hear what Mark is saying. Maybe his microphone is off.
I heard what he said. He is saying that regarding how to deal with the stray dogs, but I'm saying that is not, that is a suggestion on how to deal with stray dogs. You see, it is possible for an entrepreneur or a company which is interested in investing in that business, and they can collect or they can capture all the stray dogs and keep them in a place where they will be vaccinated, where they will be fed well, and so that they can provide services for for keeping dogs in a nice place, and then think about exporting them to countries where they eat dog meat, like Vietnam, for example. And this is something that people, good investors, can deal with that business. It's very lucrative if you look at it that way. Thank you.
Thank you very much, Prof. I think that's very interesting. We can try to test that with, and some of us here will become billionaires. So
excuse
thank
me,
you
but
so
I can't
much.
hear what Mark is saying. Maybe his
just
microphone is off.
Yeah, Yacoub, en fait, merci pour votre question. Je voulais juste répondre en disant qu'il est très, très important de renforcer les plaidoyers.
I was saying that it was very important to really reinforce, advocacy at the community level and the authorities level. This is very, very important to demonstrate to them that rabies is a huge problem because there are some people who have even died after contracting rabies. So we need we thank you for this.
Des clôtures et aussi les partages de ce qui est prévu pour la prochaine session. Sam, vous avez la parole et de ce qui me concerne.
Sam, please, for your final words. Thank you very much, everybody, and even Pauline and Serge. Thank you very much. Sincerely, thank you for your contribution. So, Sam, please, you have the floor.
I am going to try my hand at the bit of French that Mark has taught me and say, merci beaucoup. Thank you, Mark. Thank you, everyone, for making time to join this session. We are glad that you made time to join this training, and we hope that you found it informative and a call to action. It wouldn't have been possible without you being here, and so we just want to truly appreciate each and every one of us for making time to join this session. And for that, allow us all, I request that we all give ourselves a virtual clap as a form of appreciation. Again, I say we hope that we found this session, thank you so much. We found this session, I hope we found this session informative and a call to action. I want to remind us to take the survey. Kindly take the survey, the link is in the chat. We value feedback. We want to hear from you so that then we can be able to improve on our sessions moving forward. So kindly, if you haven't done so, please take the survey. The link is in the chat, and we shall be truly grateful to improve on our sessions in the future based on the recommendations and comments that you'll be making. I want to remind us that the recordings from this session will be made available to you via the email that you registered with. I truly believe, and I hope that you are able to access the previous session's recording as they were made available, and we shall endeavor to be doing so moving forward. And so even for this session, we'll make the recordings available via the emails that you registered with. We are looking forward to having you in our next session. Our next session will be held, like we said, every last Wednesday. So our next session will be held on the 29th of March. I believe that would be the last Wednesday of March, same time, 4:30 to 6 p.m. And so we are looking forward to having you there. We shall be looking at preparedness. I think the details will be shared, but we are looking at preparing towards, improving our preparedness towards Marburg, and we shall be having a case and didactic presentations from Cameroon. But we shall be sharing details as they shall be made available, as the team will be making them available. I also want to remind us that we have an outbreak investigation and response course under the AfroHoon Academies, under the One Health Workforce Academies. Allow me to just quickly type in the chat, kindly, One Health Workforce .org. Kindly visit the One Health Workforce Academies.org, and you'll get the courses that are available. So if you have time, please visit the One Health Workforce Academies.org and look at the outbreak investigation and response course that is already there. And would be glad if you'd be able to take the course as we continue building our capacities for prevention, detection, and response to public health emerging threats and other infectious diseases. Again, we want to thank you for being with us. We look forward to hosting you in the next session. We look forward to us implementing the knowledge that we are having and from these sessions and to building the capacities of the next generation One Health workforce, as well as improve our readiness to these threats and other public health events of importance. So with that, thank you for taking the time. We apologize for going over with 2 minutes. We should have adjourned at 6 p.m. But thank you for being with us all this time. And we want to again appreciate you and look forward to seeing you in the next session. With that, take the survey. As we conclude, remember to take the survey. Any other questions that have not been answered, we'll share them with our SMEs, and we shall be able to relay their responses. We shall be able to relay their responses to you via the emails that you registered with. Till next time, it's bye-bye from us, and all the best, and see you next time. Bye.
Thank you very much, and bye.
Hello. Can you hear me?
Yes, we can hear you, Christine.
Thank you. I think we are the planning team, so we can go ahead and have our debrief. You are welcome, Winnie. You are welcome, Dr. Kagarama. And I think these are people we didn't have at the start in this planning meeting, but we are happy to have you. So we just want to use a few minutes and get feedback in terms of